Hi, everybody. Thank you for tuning in to the Gorilla HR podcast. I'm Becky Droz, and today I'm going to start out with just a little bit of a current event and some things that are happening that all the people who are in the workforce or that manage people, anything, really need to be aware of. Unless you've been living under a rock, you know that there have been a ton of changes with the current administration and lots of different laws and regulations, executive orders, and the flow down that are impacting our workplaces. And yesterday, on September 4th, the administration released a list. It's called the Unified Agenda of Regulatory and Deregulatory Actions. And on that list, there are more than 100 proposals related to acts that fall under the Department of Labor. So if you are at all involved in the workforce, I encourage you to go out, take a look at reginfo.gov and look at that list. There are some proposed legislative changes around EEO regulations, around joint employee definitions, defining some of the exemptions under the Fair Labor Standards Act, the whole independent contractor status issue that's been debated and talked about for so long. So take a look at that list. If there are things that you like or don't like, please get in touch with your legislators and let them know. All right, moving on. We have a really awesome guest today. Today, I have Dr. Crystal Maxwell with me. She is a board certified family physician. She is a fellow of the American Academy of Family Physicians. She also got some special recognition when serving on the South Carolina Mental Health Commission as a commissioner. She's received awards for being a provider of the year. She's been a top 10 business leader under 40. She has a book, The Chronicles of Women in White Coats, too. She also has an MBA, as if all that other stuff wasn't enough. And most important right now, well, maybe not most important to her, but important to me, is that she is the founder and CEO of Light Family Wellness. In addition to doing all of those things, she's raising a family, she's involved with the community, and she is just really an awesome person that I am so fortunate to have here on the podcast today. So, I want to spend some time talking to Dr. Maxwell about the current state of medical things and insurance and all that good stuff and get a little clarity about some options that are out there. So, Dr. Maxwell, welcome.
Thank you so much for having me. I appreciate it.
I am so glad you're here. Okay, so I have lots of questions for you today. Honestly, the first
Excellent.
one is I'm wondering if you're actually a vampire because you look way too young. This list of accomplishments is like a list of an old person. So, one, I don't know how you have accomplished all of that. And two, do you sleep? And if not, what is the secret? And I need to
Well, thank you. I
know.
appreciate that. I get that a lot. So I have to thank my mom and good genes
Yes, yes.
for the youthful look, as well as some great skincare products and regimens that I follow and do as well. But I do sleep, even though I do like darkness. I do sleep. I like it to be pitch black when I do go to sleep, but I do sleep.
Good, good. I think that that won't be the topic that we're going to talk about today, but I think the skincare regimen and the sleep and how you're doing that, we definitely are going to have to come back and revisit that.
Absolutely.
But aside from that, so I want to just start with a question, which is, what do you really enjoy about being a physician?
I love connecting with people.
Mhm.
I love being able to kind of really be a quarterback, so to speak.
Mhm.
So people tend to like to talk to me, and I like to listen. I enjoy being able to kind of give that objective view of things, but still making sure that you know that you are cared and you are loved,
Mhm.
because medicine, healthcare can be very frustrating and
Mhm.
scary
Oh yeah.
with dealing with everything. And
Yeah.
so being able to connect with people, being able to reassure them, let them know that they're not alone,
Mhm.
and that they're having support, I just appreciate being able to do that.
Yeah, I think that's really great, and I can definitely see that people would want to talk to you and trust you. I think it is scary, especially whether it's you're feeling bad or you just want to make sure that you're doing the right things to stay on a good path. It's important to feel like you are being heard as a patient. So I totally get that. Now, I noticed that you did not say anything about bureaucracy, red tape, insurance carriers, insurance administrators. I noticed that was nowhere in the things that you enjoy.
Absolutely not.
I don't enjoy them either. In my role as an HR professional, I always hated that piece of it. You get like the people are into comp and benefits, and I'm like, no, I'm into comp, I'm into
Hmm.
HR, I'm not into benefits because those
Hmm.
things are so frustrating
Yes.
as an employer, but then as an individual. So I think when it comes to traditional insurance, we know about authorizations and you have to get approval to do this and approval to do that. And it's like you're going in circles and it's so frustrating. And then it's also confusing because people don't understand. Like you have a premium and an employer might pay part of that premium and then you might have to pay a portion and what part of that, and then we have co-pays and we have deductibles and we have co-insurance and all of these different pieces, and it's like you can go into the doctor thinking like I'm just going to have a lap done or I want them to look at my knee that hurts, and then you have no idea what that bill is going to be.
Right.
It is so confusing.
Very.
So confusing.
Very, very.
So I know that for employers, not only is it confusing for the people, but it's also really hard for small employers to offer that kind of insurance.
Yes.
So it's expensive.
Yes.
I just pulled some data from KFF, and in their 2024 annual survey, they reported that the single premium average is almost $9,000 a year for one person.
For one person.
And then for family, it is more than $25,000 a year. So if you are an employer and you're looking to provide insurance, but the premium for somebody to have family coverage is more than $25,000 a year, that could just simply be unaffordable.
Absolutely.
Like, and even if you try to pass that on to your employees, like people are making that.
Correct.
I mean, median income in our area is like under 50,000. So how can you afford that?
Exactly.
Yeah.
Exactly.
And then carriers don't want to work with small organizations either because they want more lives. It's a numbers game to them,
Right.
not a people game, in my opinion, a numbers
Correct.
game. So there are other options.
There are other options.
Like I can tell you all the things that I don't like about this insurance, and I know you know it deeper than I do. So this is where I want you to talk to us.
Okay.
So the first one is this whole idea of concierge medicine. And this is something that I think I had wrong for a long time. So what is concierge medicine?
So traditional concierge medicine is paying a retainer to your doctor for them to be your personal doctor, being able to establish that relationship, and you can call them and contact them a lot more easily than you can in a more traditional practice. However, concierge also bills insurance.
Okay.
So there's a double billing that happens. So you're paying your retainer, but you also are subject to the deductible portions, co-insurance portions, co-pays that go along with your traditional insurance as well.
So I've still got the runaround, only I can directly call that provider and be like, by the way, the insurance said they need more information for this authorization.
Correct.
And then I have to pay both of them.
And then you have to pay both of them.
Okay.
That is correct.
Okay. And then direct primary care. Tell us about it.
So direct care does not bill insurance, period.
Okay.
So it's membership or subscription model, like having a membership of the Y, that you pay either monthly, quarterly, yearly, 6 months, however floats your boat. Most people do monthly.
Okay.
But because your doctor is not also billing your insurance, then you are not subject to having those co-insurances or additional deductible that comes with each time that you go and have that visit. You know that my membership is this much every month. When I go and have my doctor's visit, I don't have an additional bill surprise coming behind that. Yay.
So that sounds amazing, right? Like
Yeah.
somebody can pay a fee, like they know what it's going to be. They go see
Yes.
their doctor and they're like, I want you to look at this mole, this rash, like I got heartburn, whatever it is. And
Yes.
it's a flat fee.
It's a flat fee. And if it's time for your physical and you happen to get a sinus infection, you can have your physical and get your sinus infection treated without the extra bill.
And all in one visit?
All in one visit.
I had a doctor's appointment once and they were supposed to do allergy testing and some kind of scan for sinus issues. And they had scheduled like the scan at the facility I was at, but they had scheduled the testing at another facility. And so they were like, well, you're going to have to come back and then we're going to bill you for both of these visits. And I'm like, it wasn't my mistake.
Yeah. Yep.
So to hear that you could just like come in and have the things you need done for a flat fee.
Yes.
Sounds pretty amazing.
It is very amazing.
I would think that that's got to be like astronomical though, like to have that level of care and get treatment. Like, is it super expensive?
It is not. Most direct primary care practices, depending on your location of where you are anywhere from $50 to $120 per month.
Wow.
So it is about the cost of cell phone
Wow.
bills in some people's YMCA membership
Yeah.
is, depending on what
Yeah.
level they're on. So it is very affordable, which is really the hallmark of direct primary care,
Mhm.
because physicians who are doing this, we are trying to make sure that you can get care, and you actually can get primary care affordably
Mhm.
when you're not having to deal with markups and you're not having to deal with red tape
Yep.
of coding,
Yep.
documentation, and some other goals from other people
Yeah.
that you have to
It's
meet.
interesting you say that, and we don't have to go too far into that, but I think you're exactly right in the sense of what is the goal or the mission or the objective when we think about traditional insurance of that insurance carrier and that administrator. Their goals are not going to be the goals of you as a physician working with
Mhm.
a patient.
Correct. I mean, I worked in traditional practice for 10 years before
Mhm.
I opened my direct primary care practice. And there were plenty of times, I mean, daily occasions where someone's coming to me with an issue that needs to be addressed, but before I can even get to their issue, there's a list of things
Yeah.
that have to be checked in order for that visit to be paid.
Yeah.
Or quality measures or reimbursement will suffer because certain things were not addressed. And
Yeah.
it puts me in a difficult situation because I see you as a person
Right.
and I see what we need to talk about,
Yeah.
but I can't because someone else is dictating what the overall visit
Yeah.
needs to
Yeah.
happen. And so that for me was not care,
Yeah.
and I had to figure out something else.
Yeah.
Yeah,
Yeah. I think that's awesome.
yeah.
Yeah. Something that's affordable to get personal treatment, to be able to call and reach out and get what you need. Now, how does this work with like labs? Like if you need to have like lab or a PAP or something like that, like that's another big mystery where it's like, am I going to pay $50 or am I going to get a bill for 500
Mm,
today? I don't know what I'm getting.
right. A lot of direct primary care practices, we have contracts with labs that are reduced cost compared to if you go online and see what a lab menu may be for like a complete blood count or getting your hemoglobin A1C check or having your
Mhm.
thyroid test done.
Mhm.
We have worked nationally as a group to be able to secure contracts to have these labs done affordably because
Mhm.
we are trying to reduce the cost of care, and
Yeah.
directly, we're taking some of the billing risk, and so we
Sure.
get lower cost on being able to do that. And while you're sitting in your visit and we're talking about, okay, this is your annual, this is what we need to do, I
Mhm.
can tell you 90% of the labs that we're going to do, how much they're going to cost while we're
Wow.
sitting together talking about your care.
Wow.
There's some labs that are what we call reflex tests, that if it such as autoimmune test. If
Mhm.
it comes back positive, the lab automatically will reflex additional testing to assess that further.
Sure.
When that happens, I can't tell you specifically how much that will be,
Yep.
but those are the rare cases. Those
Okay.
are not generally what we're dealing with on a routine
Yep.
basis.
Yep.
But even when that comes to play, I can tell you this is a general amount of what these reflex may be,
Yeah.
so you're aware of that. And
Yeah.
unfortunately, in traditional practices, you
Yeah.
have no idea. It kind of feels like the
Yeah.
wild, wild west of what
Yes.
is this EOB? And I'm
Right.
about to open it. What is it
Right.
going to say?
Right.
But we are able to tell you exactly how much those labs are going to be. And some things that are done in house, some of the point of care testing, like a strep test, there's no additional charge for that.
Mhm.
Um,
Wow.
Doing a urinalysis, if you think you have a UTI, there's no
Mhm.
additional charge for that. So things that I can get that test pretty inexpensively, I include that in your
Wow.
membership. And so you don't have that additional copay. We need to do an EKG. You're coming in for your pre-op exam. It's included in there. But if there is something that's a little bit more costly for me, then I'm able to tell you that and
Yep.
say, hey, this is a little bit more expensive test.
Yep.
This is how much it will be. Do you want to do it? Yes or no?
Yeah.
And we stop
Because
there.
there's still cost to these things. Like
Yes.
everybody understands that. But I just think about I had years ago a sinus situation and I had 2 sinus surgeries. Essentially, I had these, like, sinus polyps that were coming down and out my nose, like, I couldn't breathe, and all of these like, 2 surgeries, and then, there was a, new drug coming out, and the doctor's like, "Let's try this," and the process to get that approved, and it was, like, 2 sinus surgeries, sinus polyps literally growing out my nose. Did the doctor has to check off that I, am doing saline rinses daily? Yes. Yes, I am. But it's like, but I've had 2 surgeries.
Yeah.
I feel like trying this medicine is but like the whole process and that whole middle ground of the back and forth is so difficult. So to be able to have the provider who is seeing the patient and says, this is the care that you need, and I can tell you what it costs, like, I don't, why is everybody not doing it?
I wonder the same question.
Like,
I do.
why?
They should be. They should be. And even as you speak of prescriptions, same thing as with labs. I have
Oh,
in-house
yeah.
pharmacy as well. So medicines that I can get less expensive than GoodRx at a pharmacy,
Yep.
which are quite a few, I have them on hand. So you
Yeah.
take, you're coming in, you're sick, you do have that sinus infection, you're leaving, going home,
Yep.
instead of having to go through an extra trip of going to the pharmacy.
Yes.
And unfortunately, there are some prior authorizations required with even some generic medicines now because
Mhm.
they're not in contract with the insurance that your employer is
Right.
with. And so,
Yes.
I'm like, okay, let's go outside of your insurance. This is
Yeah.
how much it would be cash.
All right. So people who have direct primary care, do some of these folks also have like a more traditional insurance?
Absolutely. About a little over 80% of my patients have a traditional private insurance. A lot of them have the high deductible option to help cover the cost of their
Mhm.
care so that their premium is lower. And then they
Mhm.
have that little wiggle room, you can say, of being
Sure.
able to use some of those dollars that they would have been putting toward a premium to go to other things.
Yeah.
And so they're using their membership, using their health savings accounts a lot of
Mhm.
time. And so what's nice is in 2026, it's actually a regulation that direct primary care is recognized as being eligible for health savings account
That's
usage.
awesome.
It's been a gray area for a while. Lots of people have been doing it, but we now actually have it. It is good to go. It's green. Nobody can refute it or question or anything like that. So very excited
Yeah.
about being
Yeah.
able to, provide that.
Yeah, I think that's important because I think it's just that the funds that you use towards your healthcare can come from a lot of places. And so if you have that HSA that's sitting out there, take advantage of it. Even if it was
Exactly.
something that was started with an employer elsewhere and you've still got those dollars are yours, like put them to use, make them work for you.
Absolutely. Absolutely.
Yeah. So
Absolutely.
what kind of feedback do you get from your clients, whether that's organizations that work with you to cover employees or just individuals who come to you?
I work with several employers in the community, and they love having the access for their employees.
Mhm.
They love that it doesn't take all day for them to get a medical
Yeah.
issue addressed. The employees like even sometimes not having to leave the office
Mhm.
because some things are simple and they don't need to come in. We hop on a video call or
Yep.
even do some texting, and
Wow.
they're not even losing time off from work. They're
Wow.
having to take PTO time because we got things addressed. So they love the employers also like the predictability. They know how much their membership is for their employees, and there's no cost adjustment how
Wow.
much they're using it.
Mhm.
So they like having that predictability as well in covering their healthcare cost.
Tell me a little bit more about the employers that would work with you to cover people. Are they small? Are they big? Is it all people? Is it, maybe there's like a certain executive, like who from on the employer side, what does that look like for you?
It depends on the size. I have some self-employed people
Mhm.
who they don't really have staff, but they need something for
Sure.
healthcare, and so they're using direct care because premiums for major medical is just too much,
Yep.
and so they've been able to use that. And then I have smaller, anywhere from about 5 to 25 right now is what about the average of what
Okay.
each company that I'm working with now has. And some of the one company has it where you can have family members on. So they have their children, their spouse on as well. I
Wow.
have some companies who they are only doing for their employees.
Mhm.
So it depends. There's
Okay.
no, it has to be done this way.
Okay.
Some companies have
I love that
independent
already
contractors.
because so many things in the other, like, it's all about, like, the contract, as you've
Right,
mentioned several times, "Well, this isn't covered in the contract," like,
right.
where it's like, "Well, it has to be this way," like, I
Yeah.
love that it's like,
It's a
"No, we'll
lot of
do what makes
flexibility.
sense."
Some people have part-time people or contract independent contractors
Yep.
who are needing something. They can add them on.
Wow.
And so, we can decide what that looks like for your company based off
Yeah.
of what your needs are. And
Wow.
so they appreciate having that flexibility of being able to cover
Yeah.
either part-time independent contractor, family members or not family members. Some companies will cover their membership. I do
Mhm.
have a company that covers membership, labs, and medications, but then
Wow.
anything else the person is responsible for. And then I have others who they're only covering the membership. So it just really depends on where you are in your company
Yeah.
and how much, you can put in.
But even membership,
decide.
if that's, the range that you gave is totally reasonable compared to those, $9,000 a year single coverage premiums with the traditional.
Absolutely.
So yeah, even for an
Absolutely.
employer where if an employee needs to pick up some of that for the lapse or prescription, like that's still a huge cost savings for
Huge.
better care.
For better care. Having direct access to your physician where
Yeah.
you can directly text,
Yeah.
email, or call them. I don't double book. And so people are seen at their appointment time. And again, that time away from work can be
Wait, you don't make people
huge.
sit there in a paper gown freezing for
No,
45 minutes?
I don't. And that's what catches people off guard. A lot of times they're like, well, how long do you think it's going to take? And I'm
Right.
like, well, what time's your appointment? Oh yeah, you'll be done if you're a new patient in an hour.
Yeah.
Like I give a new patient an hour. It may take 30 minutes because you don't want to talk much, but you have an hour.
Yeah.
You may use up your whole hour, and I
Yeah.
may say, okay, well, I do have to move on,
Yep.
but we can schedule another hour if we need
Yeah.
to, because if you have a lot of things going on,
Right.
we can schedule for
Yeah.
what you need. So yeah, you're not having to be pulled away, taking extra PTO unnecessary because you're waiting 2 to 3 hours in the
Yeah.
office, and then
Yes.
another hour
Yeah.
once you get to
I
the
didn't even think
back,
about that. The
and it's a
lost
whole
time
day.
for
Yeah.
sure.
So
Yes.
you're not losing that. You're not
Yes.
losing that. You're seen, and then you go about your day.
Wow. Yeah,
Yeah.
I don't know why everybody's not doing it. So if somebody is interested, how do they find you?
So I'm everywhere. You can go to my website, which is www.lightfamilywellness.com. You can text me. I have a textable number that's general, 704-594-1140. My email, info@lightfamilywellness.com. I'm on YouTube, Instagram, TikTok, LinkedIn, Facebook.
Everywhere. You
I'm
really are.
everywhere.
Yes. And we'll share these so that you have
I'm
them. So you don't have to remember
everywhere.
it or like write them down. We'll make sure that you've got them. Yeah. Awesome. Awesome.
Yeah.
Well, thank you so much.
My
I
pleasure.
I don't know why everybody's not doing this. This like just to have access to care and it's affordable, win-win. Why
Win-win.
wouldn't we want that?
Win-win.
Yeah.
And being able to have access to your doctor where it's not taking 2 to 3 weeks to get in.
Yes.
Delayed care increases healthcare cost,
Yes.
and it increases your anxiety. And
Yes.
so
Because
when
you're
you
just
can
sitting
get
there
in
worrying about
and you're
it.
doing Dr. Google, and you don't have to Dr. Google,
Oh yeah.
you don't have to do
I got my law degree online. I got my medical degree online. Veterinary,
Yeah.
yeah. No, getting right to the source, the professional who actually knows is better than trying to figure things out.
Yeah.
Yeah. Well, since I've got you here, I
Yeah.
am adding a little segment that I close with that's called "Oh my God, Becky, look at those comments." So I like to, I post these videos and little shorts, and I have TikTok and all those things. And sometimes the comments that people make are like I don't know if they're just looking for reaction or if people are really, I don't know, but I've decided I'm going to start sharing them with you, my audience, because some of them are just bananas and I think that you would enjoy hearing them. And so the one I'm going to share today is actually medical, well, sort of physical related. And so I'm
Okay.
going to share it with you. So I recently posted a TikTok that was about feminine hygiene products and menstrual products and just accessibility.
Mm-hmm.
86% of people who menstruate have gotten their period unexpectedly while they were out and about. Can we please normalize having pads and tampons available for free in schools and workplaces? Please, let's help each other out. I want to share a comment. There were several, but I'll share this one with you just to get your thoughts. So
Okay.
the person said, it happens every month like clockwork. How is your period ever unexpected? As a physician, what do you think when you hear that?
Well, wow. So not everybody's menstrual cycle is predictable. And in general, a cycle can go every 28 to 35 days, and that's normal. So it is predictable-ish
Ish,
within a certain
ish.
time, but there are a lot of women who don't have predictable
Mhm.
periods. And especially young girls who are
Mhm.
initially starting to have their menstrual cycle, the first few years,
Yeah.
they are not regular.
Yeah.
So, and Stress.
So not like clockwork.
It's not like clockwork, and stress, exercise, changing the environment can actually throw off your cycle. And if you're going into perimenopause,
Yeah.
it used to be regular, but
Yes.
now it may not be
I
regular.
know.
And
My app
so
now is
things
like, your
happen.
period may start today. Your period may start today. Your period
It
may start today. Yeah.
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 So, I mean, there's predictable for a subset of women, but for a lot of women, that's not the case.
Yeah. Thank you.
Not the case.
Thank you. I'm not sharing the name of the poster, but just general education for everybody. Periods are not like clockwork. So take that, learn from that, and be a better human. That's
Yes.
that's my
I love
request.
that.
Yeah.
Be a
Yes.
better human.
Yes. Yes. Dr. Maxwell, thank you so much for coming and chatting with me
My
and
pleasure.
sharing all this information about direct primary care. Again, it seems like such a win-win and such a great option. So I'm glad that you're here to share that with people and give them a little more information. And you have to come back because I want to hear about this whole skincare thing and, like, again, what are you doing? So definitely come back and see us again.
Absolutely. My pleasure.
Thank you so much.
Thanks.
Thanks everybody for listening to the Gorilla HR podcast, and I hope you tune in again soon.
That's it for this episode of the Gorilla HR podcast. We hope you found some unconventional wisdom and actionable advice to help you in your own HR journey. Remember, we're all working together to build better workplaces. Want to join in the conversation? Send us your questions, stories, and maybe even your own guerrilla tactics to podcast@gorilla-hr.com. And if you enjoyed the show, please like, subscribe, and share with your network. Until next time.